Are you looking for addiction treatment but hearing nothing but negative about Medicaid health coverage and substance use treatment? There are a lot of misconceptions surrounding Medicaid and addiction treatment that can discourage us from seeking help. In reality, Medicaid offers a wide range of mental health services that can support you on your path to recovery. From inpatient rehab to medication-assisted treatment, Medicaid benefits provide crucial coverage that is often misunderstood. In this video, I'm going to break down the 5 most common myths about Medicaid addiction treatment and reveal the truth behind Medicaid and its role in addiction recovery, so you can make informed decisions about your options for treatment. Quick disclaimer, my name is Adam Vibe Gutton, and I'm the founder of Recovered on Purpose, a 501c3 nonprofit organization whose mission it is to help addicts recover and live amazing lives in their recovery. We have no incentives from any specific treatment centers, and our 50-state resource guide for Medicaid rehabs has every rehab we could find and did not leave any out that accept Medicaid. I was homeless and an addict 7 years ago and just want to help my people recover. So let's get into the 5 most common myths about Medicaid and addiction treatment. Myth number 1, Medicaid doesn't cover addiction treatment. One common misconception is that Medicaid doesn't cover addiction treatment. In reality, Medicaid provides a comprehensive range of substance abuse treatment services designed to help individuals on their recovery journey. These services typically include detox, which is short for detoxification, and is the process of removing drugs or alcohol from the body. It is often the first step in addiction treatment, helping us manage withdrawal symptoms in a safe, controlled environment. Detox can be medically supervised to ensure our safety and comfort, especially for those of us dealing with severe addiction or withdrawal risks. There's also inpatient or residential treatment, which is a step-down level of care from detox when those in addiction treatment centers are staying in a controlled setting overnight for stays ranging from 21 to 28 days or even more. Inpatient treatment is covered by Medicaid in nearly every state, and the duration of coverage depends on the medical necessity and policies in each individual state. Then there's outpatient treatment, which allows patients to come to the center during the day for different levels of care while staying at home or in a sober living environment. Outpatient treatment is a step-down level of care from residential treatment, and the levels of care provided are partial hospitalization program, or PHP, which is the most intensive outpatient program consisting of 6-hour sessions at the outpatient treatment center 5 days per week. Intensive outpatient treatment programs, or IOP, this is a step down from PHP and is typically 3 hours a day at the center for 3 to 5 days per week, depending on the level of care needed. Then there is an outpatient treatment program, or OP, the least intensive level of outpatient care consisting of 1 to 3 hour sessions 1 day per week or as needed for relapse prevention maintenance. Often running concurrently with nearly all levels of care can be medication-assisted treatment, or MAT. Medication-assisted treatment is often used in conjunction with an outpatient treatment program to curb withdrawals and cravings for effective substance abuse treatment long-term. Medications used in MAT can include Suboxone, a daily medication containing a combination of buprenorphine, which reduces opioid cravings and withdrawal symptoms, and naloxone, which prevents misuse by blocking the effects of opioids. Another one is Vivitrol, a once-monthly intramuscular injection used to prevent relapse in individuals recovering from opioid or alcohol dependence. It contains naltrexone, an opioid antagonist that blocks the effects of opioids and alcohol, reducing cravings and helping maintain sobriety. Another service provided by Medicaid is individual counseling and therapy. In most states, Medicaid coverage can include receiving one-on-one counseling and therapy from licensed addiction specialists. Co-occurring disorders like depression, bipolar, anxiety, or schizophrenia are common mental health services Medicaid covers, along with behavioral health services for disorders involving things like sex, gambling, eating, or shopping. Now for myth number 2. Medicaid rehab centers offer subpar care. A widespread misconception is that rehab centers that accept Medicaid offer low-quality care compared to private facilities. While it's true that Medicaid facilities may have fewer resources or longer wait times, many provide excellent care and meet high standards of accreditation. Treatment centers that cater to Medicaid only are not required to be accredited by organizations like the Joint Commission and CARF, which certify many drug and alcohol rehab centers, and are required by private insurance companies to provide services for substance use disorder to their recipients. It may seem like this makes different rules for private pay and private insurance rehabs, but many of the best Medicaid accepting treatment centers receive these accreditations of governing third parties to ensure they maintain a high level of professionalism and care. The key is researching and verifying a facility's credentials to ensure you receive the best treatment possible. You are not required to go to the first rehab center that accepts Medicaid for long-term care. Look over your recovery options and make a decision for the best quality care facility in your area. All right, myth number 3. You have to be unemployed to qualify for Medicaid. A common misconception is that only unemployed people can qualify for Medicaid. In reality, Medicaid eligibility is based on several factors, including income, household size, certain disabilities, and whether someone is pregnant or a parent. There are also some special conditions that will help someone qualify quickly, like a recent move to a new state or loss of a job and benefits. If an individual can receive Supplemental Security Income or SSI, they may also automatically qualify for Medicaid benefits. Many working people with lower income levels may still qualify for Medicaid coverage. Eligibility varies by state, so it's important to check your state's Medicaid website for specific requirements. You can find your state's website on our 50-state Medicaid rehab guide I've linked in the description below. If you're unsure, don't hesitate to apply. Many people qualify without realizing it, and Medicaid even covers medical costs from the past 60 to 90 days in many states for emergency situations. Okay, myth numero 4. Private rehabs don't accept Medicaid. It's often assumed that private rehab centers don't accept Medicaid, but this isn't always the case. While some private rehab facilities primarily cater to self-pay or private insurance clients, many accept Medicaid for specific services like outpatient care, medication-assisted treatment, MAT, or counseling. In many instances, private drug and alcohol rehab centers will have a quota of Medicaid beds or slots in their mental health services they will allow to be covered Medicaid recipients. The reimbursement rates are significantly less in most states, but in general, most people in this industry are in it to help and desire to have a business plan that caters to all walks of life, including low-income families. The key is researching and contacting private rehab centers to confirm which services are covered by Medicaid. Always check with the facility directly and verify your specific coverage through Medicaid to explore all treatment options available. Myth number 5. There's no coverage for mental health conditions by Medicaid. Another common misconception is that Medicaid doesn't cover mental health treatment, especially when tied to substance use disorders. In reality, Medicaid provides comprehensive coverage for mental health services, including therapy, counseling, and medication management, often as part of a dual diagnosis or co-occurring disorders treatment plan. This approach allows individuals to address both addiction and co-occurring mental health conditions like depression, anxiety, or PTSD. According to Hazelden Betty Ford, as many as 65% of those with substance use disorders also have conditions for mental health. Medicaid's integrated approach to mental health and addiction recovery is designed to offer holistic care, improving overall outcomes for patients. Check for an approved treatment facility offering dual diagnosis care. So, in conclusion, will Medicaid cover drug and alcohol rehab? Yes. Will Medicaid cover mental health treatment services? Yes. Is treatment coverage by Medicaid going to give you subpar, ineffective treatment for drug addiction? No. Medicaid will not only pay for your treatment at no cost to you, but there are many drug and alcohol rehab centers that offer quality substance abuse treatment for long-term inpatient treatment and intensive outpatient treatment with support groups and other outpatient services until you are ready to phase out of treatment and into standalone recovery out here with us helping others. Early intervention is often extremely important, and the later we address our substance use issues, the harder it is going to be to stop. You are not alone, and recovery is possible for you and your loved ones. We are here, ready to help as soon as you are ready to reach out. Until then, stay safe and keep living recovered on purpose. If you want to learn more about Medicaid coverage and addiction treatment, you can watch our entire guide to Medicaid treatment here. Or if you want to take a break with me and do a guided meditation for addicts in recovery, click right here.